Hey Bridget, how you doing?
Not great.
You okay? I need you to stay as still as possible for me, okay, Bridget? Can you feel me right here?
Yeah.
Okay, can you try and squeeze my finger? Okay, perfect. Can you feel me right over here?
Yeah.
Can you squeeze my finger? Excellent. Okay, Bridget. What I need you to do is I need you to stay perfectly still, okay? I'm going to grab your head. There's going to be someone else talking to you through this process, okay? Their name is Olivia. They're going to help you out, all right?
Olivia, okay?
I'm going to grab your head,
What's
okay?
going on?
We're going to support you. You just got into a little bit of a hit, okay? Do you remember anything from that?
I remember getting hit, but I don't really remember what happened after that. Did they score?
Well, yeah, they did, but that's all right. Don't worry about it. You did a great job defending, okay?
Okay.
You did a great job. Alrighty, so what I want you guys to do is I want 3 of you on that side there for me, and we're gonna flip, okay?
Which side?
They're gonna turn you.
Okay.
To the right, please. Everybody to the right. Alrighty.
Switch.
I want you guys to kneel down and grab her side, and I'm gonna say roll. And when I say roll, I want you to roll her halfway, okay? Bridget, you okay?
Yeah.
Alrighty. 1. Yes, please put her feet together and put her arms together.
Hey, EMS here.
Yes.
What do we need to, what's
So
going
she
on?
collided. I need you guys to stand by for just 1 moment. We're going to flip her all the way over, and then we're going to take her helmet off, okay, and pads.
Okay.
Okay.
Try to stay still, Bridget.
Is everybody ready?
Yes.
1, 2, 3, roll. How you doing, Bridget? You're okay?
Yep.
1, 2. When I say roll, I want you to roll her down, okay? 1, 2, 3, roll. Okay. How you doing, Bridget?
Good.
All right, Olivia, I want you to cut the pads for me, okay?
Got it.
If anybody has an extra pair of scissors, I also want you to cut across. How you feeling, Bridget? You okay?
Yeah.
Okay, excellent.
What's your name, ma'am? Bridget?
Yes.
Hey, I'm Kemper, paramedic here.
Thanks.
That's a good hit.
Yeah.
Yeah.
Oh, sucks they scored though.
Yeah.
But my neck is not feeling great.
Okay.
Probably get the
Anything
other
else
sleeve.
bothering
I'm sorry.
you? Anything else bothering you?
I feel like I can't really like squeeze my hands together.
Okay. How about your feet? Can you move your toes at all?
Yeah.
Okay, that's
I
good.
mean, I think.
You're doing
I
great.
feel like they're going.
You're doing great. Just listen to what these ladies say here. And
Alrighty, I want
get you out
someone-
all this equipment, okay?
I'm gonna
All
get
right.
the chin strap on this side.
Okay, perfect.
Together.
Once the chin straps are off, I need someone to maintain C-spine for me, okay?
Let's grab blood pressure over on this side.
All right.
if you can. I'm gonna let them do their thing.
Liv,
but
can you get C-spine for me after you're done cutting this off?
when we get the pads off, if you don't mind, I'd like to do a neuro assessment before we
Perfect.
get done there. Okay, before we move
Absolutely.
anything else. Are we ready to move?
Can you come around this side?
Yes, we are.
Okay. All right.
But
Bridget,
first, we need to do the helmet. Can someone?
give me a second. I want to do this neuro assessment, and then we'll break it to you to get this equipment off. I just want to
Perfect.
get a before and an after.
I'm gonna
Thank
grab
you very
C-spine.
much.
I want you to pull
Hey,
the
Bridget,
pads off.
Before
Okay.
Jimmy, before you squeeze, hold on. Bridget, I need you to wiggle both hands, okay? Squeeze
Riley,
as hard as you can.
did you get the other side of the helmet?
Beautiful.
Chin strap.
Can you tell me if I'm touching anything?
Yeah, my thumb on this
Pull
side.
it.
What side?
My left.
Beautiful. How about now?
Not so much.
Okay, so a little weak. You don't feel anything over on your right side.
I guess not. No.
Okay, it's all right. Don't worry. Push down with your toes for me like you're pressing a gas pedal. Good. Okay. Can you feel me touching your leg?
Yeah, my left one.
There's one more. There's one more.
Can you still feel me touching your leg?
Yeah.
Okay. Excellent. I'm gonna press down on your hips just a little bit. Anything there? No pain?
No.
That's good. All right. Proceed.
Okay, awesome.
Blood pressure. Normal. Okay, you got a normal blood pressure. That's great.
I'm gonna take over C-spine.
Okay.
Are you feeling like you're having any trouble breathing, Bridget?
Not currently, but I feel like I might start freaking out here shortly.
Do you have
That.
C-spine?
That's weird. You got somebody
I have
who's
C-spine.
Yeah.
Bridget, I'm gonna take the helmet off, okay?
All right, great.
Focus on their directions here. Don't whip the neck around when you get free, okay? Hold nice and still.
All right.
1, 2, 3.
All right, Bridget, because you have some pain in your neck here, we're going to go ahead and put this really super sexy and super uncomfortable collar on you, okay?
Great.
All right, I got the back of the head.
All right, can somebody grab the spine board for me?
Got the left. I got the back of the head here. Yeah.
Alrighty. I need extra hands. I need extra hands to lift her up. Can you guys come here for me right now?
we go.
I need 4 extra people.
Take a deep
come
breath
here.
for me. Make sure it's not too tight. All right, sounds good.
Excellent.
So this,
Alrighty. I need 1 more extra hand right here. All right.
All right. Hold on one second. We need to get the equipment set up appropriately before we attack.
Logan, take C-spine.
So let's size the scoop pressure receiver. We need to
I got her.
Do you have it?
Yep, I got C-spine.
gonna sneak kind of right here and get this other side here. All right. Got that there, Jimmy?
3 holes. You cool with that?
3 holes looks
How you doing,
good.
Bridget? Good.
Yeah, I'm cool like that.
Oh, it's not scary. Okay. All right.
There you go.
2 feet first.
All right. Sounds good. So we'll slowly just move.
We're gonna move the feet
up.
together here.
And we'll pinch down here first. I'm latched.
Okay. Alrighty. Let's focus on the arm as we go in. Let's do one thing at a time so we're not all moving in different directions, okay? Bridget, I'm gonna lift your right arm really quick. You're gonna feel a pinch near your butt and your back here. I'm sorry about that. Okay. Let's do the same thing on that side. Move close. We're not gonna shove. We're just kind of gently placing. Okay. All right, here comes the pinch, okay? So I'm gonna have to stand over her here to keep that seat spine in line. I'm gonna put my
Okay.
foot right where your knee's at. All right, I'm taking this over. All right, Bridget, don't be whipping or anything, okay? Don't help me out at all. We got
Okay.
you, okay? All right, let's push these together. You should feel a click.
It won't pinch your back. There's a gap.
Administratively,
Okay.
I'm gonna move this and grab your hair so it doesn't get
Thank
pinched
you.
in that. Okay.
So yeah, sometimes you gotta just, yep. Big push, big push, big push.
How you doing, Bridget? Good. Okay. All right, we need to move her down a smidge.
Okay.
Because her head is kind of resting on this bar.
Come on this side,
All
Dylan.
right, so let's grab
Nope,
any
there.
kind of
Okay.
equipment and padding that we, not the board itself, but her on the board is what we're trying to accomplish
Cross.
here.
Bring your
So,
hand
You
here.
just want to touch the shoulder right here, or just evenly do it and just slide. Can't be your call.
all right, everybody ready and set?
Yep.
Yes.
Okay, we're doing on 3. 1, 2, 3. That's enough right there. Excellent.
All right. Your stretcher is ready for you at the foot.
Okay, let's bring the stretcher right here so it's just an up-down lift. I want 2 people, so we'll have one on the front here, one on the bottom. So what we're gonna do is pick her up and slide the stretcher laterally underneath, okay?
Yeah, we're just gonna kind of snake it around on that side.
So 2 people on each corner, 2 people on each corner. Let's forget about the middle for a minute because we need the stretcher to move underneath.
So
So
come down here.
I need 2 people on
Katie,
each
here.
corner. There's a handle here, a handle here. All right, I need 4 people on the scoop stretcher, okay? 4 people. 4 people.
I got it. Okay.
Okay.
On the left, you don't want to come straight over?
That'll work too, either way.
Whatever you want to do, man.
Yeah, that'll work. It's set. Okay. I got you here. What I need you to do is police this movement straight up and down, okay? So we're going to lift up and walk that way
Okay.
onto the stretcher.
Okay.
I need 4 here, and I need you to make sure we're moving straight, okay? All right, everybody ready?
Yes.
On my count, and we're going on 3. 1, 2, 3. Excellent. All right.
Straight ahead.
There it is.
Okay, good. You're
Yes.
good. Slowly.
Okay. All right. You were doing a great job with C-spine. If you will take that back over, watch your elbows here because I'm going to pop this.
Okay.
We're going to get her off this board, okay?
Okay.
So we'll do what we did a second ago in reverse. We'll fillet it out and just slide
Yep.
this way.
All right. So I'm going to pull this right side, her right side first, okay?
We got you,
There we
Bridget.
go.
You doing okay?
All right,
Staying
I'm
calm.
pulling off of her left side here. Left. Excellent. Jimmy, you got enough traction there?
I got plenty.
Okay. Let's support that board so it doesn't flap and hit her.
I got it.
Beautiful. All right, we're going to leave her right here. Let's get her strapped in. Let's get both side rails up. All right. Strap you in too hard here, Bridget. Okay. We're going to take the straightest path to the smoothest course here. So that's going to be straight ahead, it looks like. We're going to get her in the ambulance, get some monitoring equipment
Get
attached.
cameras to move.
We are going to be very cautious with our C-spine here. But so let's raise it up to a level that we're okay with here.
Okay.
What's your name?
Logan.
Logan, okay. So there's a plus button down there. Okay, so it will jerk a little bit when you let go of it. So gentle up until Logan says stop, okay?
Okay. Go ahead. Go ahead. Stop.
Right there. You comfortable there?
Mhm.
Okay, we're gonna walk straight and we'll get her loaded into the ambulance, okay?
Okay.
And exercise.
I'm so sorry.
You're fine.
I'm so sorry.
You're fine.
You're killing it.
Yeah. I can see you again.
Yeah, of course.
I did not like that at all.
We got some Benadryl if you.
Thanks, everybody.
Get a single vital either.
Good job.
All right.
Get a single vital either.
Not freaking out.
That's on me.
Let's kind of come back this way.
Thank you.
If you were part of that group, kind of stay
This is
close.
Logan's.
Everybody else kind of come in behind.
I sold the coaches' plans to their 10
Oh, what the heck?
I'm so sorry, guys. I wasn't sure when to give it over to you. I am so sorry. Okay.
Okay. All right. So let's start
That's
with
Logan's.
What went well. Okay. So those in that group, what do you think you did well?
I feel like we listened to the instructions of the EMTs.
A little louder for me.
We listened to the instructions of the paramedics and the EMTs.
Okay.
Kept reassuring the patient.
Reassuring the patient. Yep.
Yeah, I thought the communication with the patient was great. Like actually treating them like a person rather than just like a mannequin was good.
What else did you see? Observers?
I mean, from what I can hear, I think Logan did a good job kind of taking control of the situation, delegating who's going to do what, assessing what the patient needs and all that.
She did a good job when she had to call in extra people as well.
Okay. Okay. Recognizing the need for more people. Okay.
Logan also did a great job when we were starting to roll the patient. EMS approached, and instead of like freaking out and like changing our plan because they were there, she said, "We're gonna finish what we're doing, and then I will give you further instructions."
I felt so disrespectful. Was that the right thing to do? Okay.
Yeah, it's a little bit of a test.
Bridget, from your perspective as a patient, what went well?
Great reassurance. Even the EMTs were talking to me a little bit, which was nice. And I liked how you did an assessment before putting the C-collar on. And they kind of led that part while you guys were holding C-spine. Yeah, and not freaking out once EMS does arrive, like they said, because kind of that handoff can sometimes get overwhelming.
Yeah. So I want to add a couple things with that because this is exactly why we do this kind of drill, because we have been practicing it independently, okay? And now we've added in another provider, which really kind of changed process a little bit, right? Okay? And you didn't let it freak you out. There wasn't any kind of disrespectful exchange of like, hold on, that's not how we do it here or anything like that. Everything was appropriate and you worked together. Again, letting them go ahead and do that neuro assessment and not saying, oh, well, I didn't do that or I should do that. Like, yeah, it's getting done. It doesn't matter who's doing it. It's for the betterment of the patient, and that's what's important.
If I can on that, she said something really important, betterment of patient. EMS has figured it out a while ago. You guys seem to do a really good job with it this time. The more relaxed, and not really relaxed, but the less anxiety you have, the less anxiety your patient's gonna have, because they're gonna go, I don't know, these guys are doing what they need to do. And you see what I mean? It's always about patient outcomes, better patient outcomes. And if you can keep your patient less anxious, that is always gonna be better for her, right? So, anyway, that's just a big point that we hit in a lot of places.
Okay. I have some other comments about that, but I'm going to save it to kind of the changing. So let's hear from the group about what you do differently. If you had to start this over, what would you do differently?
When the C-collar got put on, her head was bobbling a lot. Like, I tried my best to keep it, but it got just like shoved under there and not like a real smooth transition.
Okay.
So there's definitely some movement that could have been prevented.
So how could we do that differently in the future?
Just communicating with whoever's putting on the C-collar and maybe slow things down a little bit. I understand it's a very like emergent injury, but you can still slow things down so you don't cause further injury.
Okay. Okay.
I agree. I feel like at least my accuracy with C-spine when I first got there was a little bit off, and that's the big picture item. You need to maintain the C-spine, and that needs to be the first thing. And so until that was steadily sustained, I shouldn't have done anything else. I shouldn't have called for anybody else. I should have just sat there and made sure it was locked in and then move forward.
Okay.
Well, it was kind of hard for me because I couldn't say anything or step in.
Yep. But you wanted to.
Yeah, it was really hard. But just checking everyone's technique, not to be like the technique police, but like Logan was in a very uncomfortable situation when you were doing the flip.
Mhm.
Your hands were flipped, so you had to turn.
Mhm.
Yeah.
And it was just like making sure
Yeah.
everyone is like comfortable and not like rushing, like Liv said.
Piggybacking off of that, and kind of going to other comments earlier, the patient was conscious, alert, and oriented. Breathe. Okay? Take
Big-
your
big
time
check.
with all pieces of this because she's currently stable. So take that extra second. Do I have my hands in the right place? Am I slowly communicating? Am I clear in what I'm doing? Again, this is an emergent situation, but she's conscious, alert, and oriented. All right. So just keep that in mind. Like I say all the time, kind of read the room, read the situation. Let that help guide you. Yes, there's a sense of urgency there, but that calmness has to come through because it builds trust with the other providers that are coming to the scene, as well as keeping that patient calm. Yeah.
I would just kind of, the seat collar I felt like wasn't very secure on me. Like I felt like I could move around pretty easily with that. And then the second thing, I'm conscious and alert, okay? And football players are pretty dumb. So, like, just
Wait a second.
Someone said C-spine and someone said cervical. Like, I have no idea what that is. Like, maybe be like, hey, we are concerned that you probably broke a vertebrae in your back.
Okay.
You have very important nerves going through that spine. Therefore, you have to stay still. Like, telling them why they have to stay still instead of just stay still, there's a C-spine injury. Like, they have no idea what that is.
Yeah. And I would maybe bring that down
Even
a
more.
notch.
You have a neck injury.
We're just being extra
Be
cautious.
cautious.
Yeah.
You've got some pain in your neck. You've got some tingling. We want to be really careful.
If you
with
think
your neck.
about it, one of the things you guys do in most of our hospitals and most of our things, your patients are not medical providers usually. So no matter what the scenario is, it's talk to their level. It's not like they're idiots, but at the same time, they don't know the same terminology you know. So make it simple. Again, what are we trying to do? Lower their anxiety level. So, hey, we're worried about a spinal injury. We're just going to take our time and we're going to make sure that this is all right. Does that make sense?
Yeah.
Because they won't, like you said, C-spine, I think there's a few groups of people that know about that. Everybody else is just like, oh yeah, I broke my neck, right? So I think that's just, and you guys do a good job pointing that out.
Yeah, I think
in
one
other
thing that you
spaces.
did really well, when they were removing the equipment, was you gave a direct instruction to the patient that, hey, we're taking this off.
Yeah.
Stay still.
Yeah.
Okay, just hold still. Don't need to be moving around with this. Okay, that's again reassurance to the athlete. Like, I'm aware that you are there and you don't know what's happening. Just hold still for us.
I also think. Oh, please no. Please go ahead.
I just want to add to that. It's a technique called signposting, essentially. So you're letting somebody know what's about to happen to them at each step of the way. It goes miles to get compliance. It handles anxiety. If people are aggressive, you say, "Hey, I'm here to help you. These are the things I want to do, and there's why I want to do them." And explain like the next couple steps you want to take. Like, 98% of the time.
That also calms you. He calls it signposting. I call it narrating care. So like you're talking through what you're doing. That helps the patient know, but it also keeps you in the moment of like, okay, this is what I'm doing. This is what I'm going to do next. It is a very calming process for you as the provider.
My transfer of care needs a lot of work. And I think it's also just practice because I wasn't sure when I needed to give everything over to them. Once the first time he said, hey, I'm going to do the neurological assessment, I needed to back off.
I don't think you needed to back off. And correct me if I'm wrong, because your role was still in charge of that scene, but recognizing here's another provider that needed to happen. Okay? Whether it was you or somebody on your team or EMS doing it, it needed to happen. So I don't think it's you backing off. I think it's an acknowledgement of like, okay, yeah, great, we need to do that. I'm still right here. Let me know what your findings are. You just continue that communication with them.
Yeah, it's interdisciplinary at that point.
Absolutely.
Like if you're clearly managing the priority up there, so if I can break in and do a thing or two that I need to do that is going to help us get more information, I can distract the patient a little bit. I can do, like that's. I don't think there was a major issue there. I think when it came to the movement of like going onto our equipment versus yours, I think is where the confusion is. And ultimately, it's beautiful to say in a textbook and to learn things. This is when patient care is transferred. In reality, we are blending that situation and like, hey, this is how this thing works. Let's get it set up. Blah blah blah. Move, blah. Like so. There's a little bit of a blend there, and I think ultimately what both of us could have done a little better is, as we're walking away, maybe I should take some hands off and be like, so what happened exactly? What did you find? All that stuff. While this movement process is happening is typically how it would go in a field call. Is that
in a medical timeout, what do you guys like to hear? Because that kind of threw me a little bit for a loop, I'm going to be frank.
Sure.
What do you need to hear?
Most of the time in a standby situation like that, we need to know how to be dispatched.
Okay.
So like when you need us and what the expectation of our arrival, like if there is an SOP or like a standard operating procedure about how we bring equipment or where we go. Can we drive on the field? Can we not? You know what I mean? Like, so all that kind of stuff about how we get to there and how we communicate is really the big stuff. The rest of it, we have protocols and we can, I think for me, it's a game time thing to see how y'all do things versus how I do them. If this is how it works here, like unless it's something egregious is happening or what have you, like I'm not going to interfere with that. Like this is your bread and butter. I will eat the C-collar. I hate the damn things. I think they're trash. So personally, and this is the one situation they exist for nowadays.
Okay.
You know, so most of the time I'm more concerned about cerebral perfusion, being able to get venous drainage from the neck, not occluding carotids and all that kind of stuff. It's very, very rare for me to have a legit C-spine injury. So so I'll eat that on my end. Like that was not a well-placed C-collar, and the placement of it, to your point, could have been better. But that's really what we need to know: how to get there, what we can do when we get there. The rest of it we'll sort out.
Awesome.
So one thing I would add to that, relative to yeah, I mean.
I didn't mean to interrupt you.
No, that's okay. So, I mean, the ones that we have, we use ours, right?
Yeah.
They're the same.
Thank you,
All the
Riley.
same adjustable tubes.
The only thing you're doing.
So a lot of places are considering moving to a soft collar again.
That's what I asked.
So we're not there yet. We're kind of waiting. Honestly, if you guys change your protocol, we will change ours.
I can't wait.
Yeah.
I know cone, Moses cone, usually the one that's two pieces, and so one slides behind
Yeah,
and
we have
the other
those.
goes on top.
Jay,
Some people like those.
Yeah.
These are
The
just
X
like,
collar didn't work out.
Okay.
Way back when, which was kind of cool but terrible.
Yeah, we have some of those. But going back to the timeout, one thing that I think is important is communication about what equipment you have versus what equipment you all have. And in reality, you know, in Guilford County, if you're at a high school, you need to have those conversations ahead of time to know what their protocol was. Now, we had a conversation before this event to know what their current protocol was, that they wanted to use a scoop. And we're like, well, we've got a rigid spine board, they're going to use a scoop. So having that conversation, it's fine. This is a training exercise, so don't feel bad about it. Don't beat yourselves up about it. But that's something that would need to be covered in that medical timeout. Like, you know, if we had a C-spine injury, you know, we have a backboard, you guys have, what do you have? What's your current protocol? Because maybe something has changed. Okay.
So understand, from the outside looking in, we're not this. You are. We are everything else. I think a couple of words have been used that you guys are going to have to get used to, because this interaction between EMS and AT has always been awkward. Communication, what Jolene said, I think somebody said collaboration. If you guys can keep in the back of your mind as you go off to places to work that, hey, we're not at odds, we just have very different jobs and they intersect in one place.
We
And
use a
it's
phrase
right
called
there.
cross-pollination.
Oh, that's
So,
nice.
I mean, you guys have heard me talk about, like I went out to Hickory with Fry Medical. I'm doing one in July. I need 8 models, by the way. So Atrium Health at Wake
Should I'll
Forest.
do
It's
it.
Why
all
not?
about cross-pollination. We are in the room with EMTs and paramedics and sideline docs. We're all there together working through the language. Like,
That's
what's
it.
our common protocol? gonna be?
Understand,
It has to
we are
happen
looking
ahead
to
of time.
work with you.
Yeah.
We just want to make it as smooth as we can, and we just don't do this very often, being honest. I mean, I don't know, 20 or 30 games, that's That's all I've ever done. So it's not a bunch of times. So you guys set that tone. Communicate, collaborate with your EMS people because they're interested in helping you be better. Because what was it all about again?
The patient.
Outcomes, right?
I had one thing where like you did the all call signal, but they didn't necessarily see.
Yeah, you got to get that
Okay.
hand up.
Well, and also
Yeah.
knowing that on the field there's going to be other players at that moment surrounding, and they may not be able to see. Like at my high school, they were in the corner, and
So
they
true.
might be in the truck or whatever they may be doing because it's a football game. They may not be watching every single moment. So maybe in the EAP, knowing that you might have an assistant coach or whoever going down that way, being like, hey,
Really good
to
point.
let them know as an extra step of care.
Yeah.
Really
It
good
wasn't
point.
I saw
Really good
the
point.
hand motion, but it
Yeah.
was very brief, so I wasn't really sure
Yeah, I
exactly.
kinda
Really
gave
good.
it to 'em.
Yeah.
Really
Yeah.
good
Yeah.
point. Really
I
good
always
point.
look at the operations person when I'm like doing an all call too,
Mm-hmm.
because they're usually close by or really looking at the field because they're going to make the decision what to do with the scoreboard and the stands and everybody. So I try to make eye contact
Mm-hmm.
with an ops person as well. I will say one other thing with your eval on the field.
Mm-hmm.
I don't think you palpated my neck, like my C-spine at all.
I didn't.
You just went like with neuro and motor,
Mhm.
which is still great. But if you're deciding, to bring EMS out on the field in a high school football game, like you need to be,
The
you need
neck.
to have every objective saying that you had a reason to.
Yes.
Because they're going to be asking a million questions afterwards.
Okay.
So you need to make sure that you palpated that. I think I said I had neck pain.
Yeah, I still
It's
should have done it.
actually-
So I do want to address, so from a personal experience, high school football. Number one, athletes have a heightened level of awareness of the potential for cervical spine injuries. They do, and concussions, okay, because everybody and their brother has warned them about it. Okay, so the minute an athlete has any kind of pain in their neck or a tingling, maybe they get a stinger, a burner.
Yes, that's what I was
that
just
is
gonna
yet. You'll learn about it in eval. Okay, but a burner to cervical, brachial plexus injury. That's you kind of have a momentary stretch of the big nerve plexus that can give them some transient symptoms like that. Take your time. If the patient is conscious, alert, and oriented, take your time. Okay, do that on-field assessment because I mean, once you make the call, you've made the call.
I had a girl
There's no going back
just start
with it.
panicking, so she just clenched her traps. So then she started losing feeling in her arm, but that wasn't because of a cervical spine injury. It was a goalie, and she just started freaking out. And so
Anxiety
she just,
can do it.
yeah.
Absolutely, absolutely.
When they were cutting the equipment off, I kind of felt bad because I felt like I was hovering, but I was also trying to see if they needed extra hands. So I didn't really know what to do in my role because Katie had the crowd, but then I was trying to make sure they had hands if they needed them, but I didn't want to feel like I was like watching over them the whole time, like while they were doing their job. So I guess just knowing like where I needed to be.
Yeah. So what was your role?
I was AD.
You're an AD. I honestly am not even recalling where you were in the situation.
I tried to stay out of their way because I know at one point Liv told me, I'm going to take over C-spine. I need you to help get the shoulder pads out. So then I stepped in. But then before that, I just felt like I was kind of like
That's
Yeah.
okay.
hovering
That's
over
okay.
them.
That's okay. That's okay.
And like, I don't know.
But you're there.
I didn't know
You're
if it,
a
like-
person that has been trained in the process, and you're there when they need you, or if they need you. Absolutely.
And if I could, this is something that most of us struggle with coming in, and I don't mean to single you out because it's for the benefit of the group, but like, you can't accomplish anything in a mode of like anxiety or panic. It is only going to hurt you. So even if this is a dead person in front of you that you are responsible for with a stadium watching you, there is no logical sense in that. You're going to feel it, you know? And it's a personal journey in finding that detachment point of like, I'm gonna feel the thing, but that's not my business right now. This is my business right now, right? So it's easy to say, it's really difficult to do, but for me, it's a logical truth that you cannot function effectively in that state. So if I need to be effective, I need to find a way out of it, right? And that is, there's a million stories. A cop witnesses a 5-car pileup. There's a bunch of bodies and fire and everywhere. He turns around, takes a breath, looks at this beautiful field next to him, and turns around and goes to work, right? That breath will save you, that first breath will save you minutes down the road, you know? So it's worth it. Even in the cardiac arrest situation, if you are there, you feel yourself there, okay, let's do this thing, you know? So that's something I encourage everyone to practice in scenario because it's a great place to learn it.
We've got a saying with that. Slow is smooth,
Smooth is fast.
and smooth is fast.
Yes.
They finished it before you even get started. Slow is smooth, smooth is fast.
You want it to be smooth.
Sorry, you were going to
No,
say
I was just going to say, if we kind of compare this to the first group, where we had a really good example where, again, this is not picking people out, we're learning from this. Brandon had a moment where he kind of lost a little bit of awareness, and Molly brought him back in, okay? So in this situation, if you guys felt that Logan was anxious, somebody on her team, okay, the assistant AT, has got to do something to bring her back in. Say something that's going to calm her down, reassure her. If you're seeing a lead kind of get in that space, you got to bring each other back.
if you can, that's one of those times, at least on scene for us. If we were in charge of the scene or training or, sometimes captains or whatever, they wouldn't speak directly to you. They would say to the whole team, they'd look at the team and go, hey guys, remember, slow is smooth and smooth is fast. So you don't have to single anybody out. Just say it to the team. It was an easy way to do it. You pick whatever the heck you want to do, but just understand, you do not have to call out the person who's anxious. You need to remind the team. Does that make sense?
Mm-hmm.
Okay, everybody take a breath. Something like that.
Something easy.
Something easy.
I do box breathing. I'm gonna take a breath over the span of 4 seconds, release over 4 seconds, and kind of just keep following that. On calls like this, my heart rate can get up into the 180s, if not more, and I'm breathing 40 times a minute. My hands don't move well when I'm working that fast, right? So like she said, stepping back and taking, breathe in, breathe out. I don't say it out loud like that, but that's what has to keep me kind of cool, calm, and collected, or else, again, I'll be moving way too fast and nothing will really get done, right? Really taking that step back in that 1,000-foot view.
I so appreciate your honesty in sharing that, because several of you have asked, like, how can I calm myself down? Okay, it's not just you, okay? Any profession that is dealing with high stress situations has to find a way to bring themselves back into the moment. So don't beat yourself up about it, okay? It's a very normal process.
Anybody know where square breathing came from?
Special operations.
The Navy SEALs came up with it.
Where's
So
Dorian?
they've gotten some stress.
Yeah.
The SEALs came up with that, man.
Yeah. But it slows your heart rate down.
So
and
think of the high anxiety.
like if you have like a Apple Watch or a Garmin watch, next time you run one of these scenarios, look at it halfway through the scenario and just take a mental note of what your heart rate is. I guarantee it's going to be up. And if it is, like you just said, take that second back and all right.
Yeah, it's still up there.
Couple deep breaths. And try to get that heart rate down a little bit. I promise you'll be thinking a little clearer and moving a little smoother, right? So,
Awesome.
I forget all the time.
Okay, so we're gonna transition to our last
Where did you get
scenario.
these?
So we're gonna
I ran the first one. I was going to say like at least the same thing.
Thank you guys for bearing with me on that one.